discussing some aspects of child mental health. Child mental health refers to psychological well-being and normal development. Compared to adults, child mental health is relatively more multifaceted, developmentally embedded, and determined by systems involving individual, family, peers, school, community, and broader society. Many times we have a lot of questions about child mental health. So I will be talking about some of those common questions about child mental health. Firstly, why is it important to know about child mental health? Childhood is a distinct formative phase of life, and children are potentially more malleable in this phase. With the right influences, we can shape them into better beings. Further, healthy children are the future of our nation. Thus, it can contribute to the nation's growth. How many children in our country would be requiring any kind of mental health intervention? This is an important question in terms of magnitude and in need of services. According to National Mental Health Survey 2015 and 2016, this suggests that nearly 9.8 million children aged between 13 to 17 years require active mental health interventions. So this is a huge magnitude of population requiring help. So what are the common problems that these population of children are experiencing? The problems can range from developmental disorders to excessive worries, sadness, which suggest internalizing problems. It can also involve suicidal tendencies, post-trauma stress problems, behavioral problems such as aggression, hyperactivity, antisocial behaviors. Problems can be in the context of school and learning difficulties. Children sometimes can also present with very severe mental illness such as schizophrenia and bipolar disorders. Do childhood problems continue into adulthood? Why is it important for us to know that whether these problems do they remit or do they continue into adulthood? Many childhood onset problems are known to continue into adulthood. Some of the popular research in this area has shown that almost 50% of childhood disorders tend to continue into adulthood. It's a reverse way also has been proved, where adults have been evaluated and 50% of them had their onset during their childhood. So this 50% is an approximate number, but what it suggests is that a significant amount of children have a chronic long-standing problems. This emphasizes further of the importance of early recognition and intervention. So what can parents do, and when can parents suspect that their children are having some problems? So if parents notice that there is sudden changes in behavior in comparison to baseline way of functioning of the child or baseline behavior, there can be sudden academic decline or gradual academic decline, excessive worry or anxiety has been noticed, children are found to be excessively crying, there can be severe anger outbursts, children can manifest their problems through self-harming behavior, children can have sleep and appetite disturbances. So any of these wide range of problems can potentially indicate the child might be experiencing certain mental health problems. It is always better that parents do seek help from appropriate mental health professionals. So many times parents do ask us what causes mental health problems in children. Although exactly we are not aware of exact etiology of child psychiatric disorders, but largely we are aware that it is a combination of effects, largely such as genetic effects, other biological effects and environment. So our all interventions are directed towards trying to modify and mitigate the influences of these factors. So the next important question that parents pose is that is child mental health problems or child mental illness are treatable? Definitely child mental illness is treatable. However, some problems can be chronic, which needs more of environmental accommodation to reduce disability. So what kind of treatments might be suitable for children facing psychiatric problems, or for that matter psychological problems? We usually plan comprehensive interventions based on comprehensive formulations, and this can range from developmental interventions to psychosocial, or it can be purely medical treatments. Depending upon the problems, we tend to tailor make the intervention plan. Many parents are worried about side effects of medications, and they worry whether these medications can affect the development, the brain's development of their child. So this is a common worry, but I would like to reassure all of them that psychiatric medications is considered usually safe, especially if it is used under the guidance of psychiatrist or any other medical professional. Of course, all medications for that matter do have certain side effects, but if it is used judiciously and under supervision, definitely the benefits will outweigh the risks. So where can I get help for mental health problems is questions that is there in almost all the caregivers' minds. So mental health problems do carry certain amount of stigma, but delaying treatments can always be detrimental to the child. So it is always advisable to take help from psychiatrists or psychologists or psychiatric social worker or counselors or psychiatric nurses. All of these professionals can offer some or the other forms of intervention. If they are not able to offer intervention, they can always be source of proper referral to appropriate clinician or appropriate service provider. Another important aspect in the lives of children are school. So school authorities sometimes do get worried about having a child with mental illness, and they do ask what should be our stance. Definitely the school authorities should not be worried or concerned about child with mental illness. Rather, they should accommodate the child, making all necessary adaptation in liaison with the treating team, and provide equal opportunities for children with mental illness, because all of these children have the same amount of potential to reach their maximum abilities and maximum competence. What parents can do to ensure the normal development of a child? This aspect runs not only with the child, the interventions and the strategies are well beyond and before the birth of the child. So timely antenatal consultation, nutrition of the mother, positive environment during pregnancy all go a long way in ensuring normal brain development. Further, safe birth and postnatal practices, regular immunization, developmental monitoring of the child with adequate and appropriate environmental stimulation is very essential. Understanding the age appropriate child's basic needs such as safety, warmth, stimulation and monitoring can be very helpful. Early recognition of any deviant behavior or any other abnormalities, as earlier mentioned, such as sudden changes in behavior, crying spells or sadness, will warrant seeking attention as well as seeking help. Further, examinations, as we all know, is an integral part of school going children, and often exams trigger apprehension in most children. But not all of them will experience impairing anxiety. So for those children who experience those kind of severe impairing anxiety, what parents and teachers can do to reduce the stress levels? Basically, it is about having a realistic expectation. So many children have a lot of disabilities. It may be overt or it may be not visible. So having realistic expectation can be helpful. Understanding the child's ability, providing appropriate toughness of exams, instilling right motivation and spirit of education, and avoid penalizing for or punishing for low performance. So many times this happens that children do get reprimanded for low performance, and that leads to a cascade of behavioral problems. Further, parents and teachers can minimize comparison, offer constructive feedback so that child can learn from his mistakes and overcome and build on the strengths. Despite all the above efforts, sometimes children do continue to have academic problems. So what children and parents can do is that they can seek consultation from mental health professionals. So as I mentioned, a lot of mental health problems is associated with academic problems. So it could be that your child can be facing any of these mental health problems, and that could be the reason for which the child is facing difficulties in academics. So treating and assisting the child in this mental health problems can definitely improve the academic problems. Another common question is that use of certain brain tonics and drugs, medications to enhance memory and enhance academic performance. So many parents do have this notion, and many of the children are on such medications. In general, all these interventions, all these options are not evidence based as much as the research goes on. Suppose academic decline is due to any medical or psychiatric conditions, in such situations use of medications will help in improving the academic performance. Otherwise, it is not advisable to use any form of medications or brain tonics to enhance memory or brain function without psychiatric consultation. So to conclude, it is easier to build strong children than to repair broken men. So childhood is a distinct period of life associated with unique strengths and vulnerabilities. Therefore, it calls for a specialized approach and a necessary thrust from critical stakeholders. With this, I would like to end my discussion. Thank you.